Hello, and welcome to the AHF podcast. I'm your host, Joe Schwab. Our guest today is Juan Suarez, an orthopedic surgeon at Baptist Health Orthopedic Institute in South Florida. I've known Juan for a number of years, but this past year at the 2024 Anterior Hip Foundation annual meeting, he received the Joel Matta Award for Excellence and Innovation in Anterior Approach. So it's my pleasure to be sitting down with Juan today to have a conversation. Juan, welcome to the podcast.
Thank you for having me, Joe.
So tell me a little bit about yourself and your background.
So, I currently practice in Miami at Baptist Health, South Florida. My career has kind of been pretty interesting. I grew up in Puerto Rico, and I did medical school there, and then I did my residency at the University of Miami. Then I did my fellowship at Ortho Carolina, and then worked at the Cleveland Clinic for some time in Florida. And then I was commuting like an hour to work every day, and then got this offer basically in a hospital that's a mile from my house.
Oh, wow.
And I took it. And obviously there was some hesitation there because I was doing very well where I was, but I've been there for the last 5 years. It's been a game changer for me and my family.
So, and you ended up in medicine. Am I right in remembering that your father was a surgeon, right?
Yeah, my father's a general surgeon.
Yeah. Was that influential on you in your decision to go into medicine?
I don't think it was influential in the sense that I saw him and I'm like, I want to do that because, he works, he's 75 and still works.
Oh, wow.
So he's still rounds on the weekends. And and I looked at that and I'm like, I don't want to do what he's doing. But he was influential, and he still is influential in the sense that I knew what it took to be a doctor. I saw that in him, like the discipline, the dedication. Like when I got into medicine, I knew that was the standard. And if I wasn't willing to do it that way, I was probably not going to be able to do it. So that's the influence that he kind of put on me.
So what, if it wasn't a direct influence from him necessarily, what led you to medicine?
I'm not a risk taker in life, and medicine is a career that I think, at least the way I see it, and I educate my daughter that's a pre-med student right now. If you work hard, you see the fruits of your work. It's not like going into a business that there's a lot of uncertainty.
Yeah.
Like you're like taking risk with money or time or commitments. Medicine, it's a very rewarding career. You're helping people, and for the most part, it's pretty predictable to a certain degree in terms of the fruits of your labor. And that's kind of how I saw it at that point. Initially, I wanted to go to vet school, to be honest with you, veterinary school.
Oh.
I love animals, and that was, but then as I started my undergrad training, I'm kind of like, I kind of like drifted away from that after working with some vets in the beginning. But that's kind of how I saw it.
That's interesting that you mention, business and the uncertainty with business, because you've definitely shown some entrepreneurial spirit. You've done some development in the orthopedics world with things like Cuptomize, and are you at a point in your life where you feel like even if you were to enter into an enterprise like that, you could weather those storms?
Well, I like the academia. We have a fellowship, and I like teaching, and I like some of the research that we do that's clinically relevant. But I think the thing that I'm most drawn to in what we do is innovation. I love that part of it. I love to work with smarter people than myself in how they think and how they push the envelope. And that to me is fascinating. I wish I had more time because I'm so busy clinically that sometimes, something's got to give. The day has 24 hours. So either it's family, it's business, it's practice, something's got to give. But, there's risk on that. But I think once you understand what you're getting into from the medicine side, in terms of once you understand what you're trying to do, I think the risk is a little bit mitigated. I take more risk investing with my brother in real estate than
Right.
because I have no idea what they're doing. I just
Right.
give them money and I don't know what they do with the money, but that's more of a risk in my opinion.
Yeah. So was it that interest in innovation that led you to, or how did you end up gravitating towards anterior approach hip replacement? What was that story?
It's funny. I remember it like yesterday. It was 2007, and I was presenting the paper that I wrote in my fellowship at ACAS, and it used to be at the Gaylord. And ACAS wasn't a huge meeting back then. It was maybe 1,000 people, maybe 700 people.
Okay.
And in one of the breakout sessions, the Pew had this thing with Mata about anterior approach. It was a small room. We were literally like maybe 20 surgeons in that room. And then there's this guy talking about the anterior approach. And I'm like, dude, that makes sense. Like, that guy kind of makes sense to me. I just don't know if I have the gonads to go for it, but that makes sense to me.
Yeah.
And that's kind of what sparked it in my brain. I never trained with anybody anterior approach
Ortho Carolina wasn't doing it at that point.
because Masones was not part of the fellowship and he was doing it. So nobody else did it. It was all posterior approach. So, but I'm like, man, that guy makes sense. And that started me going to courses, cadaver labs, and that kind of triggered the whole thing. Something that I've always thought about, man, and this is something that I always tell my fellows, the education of joint replacement in this country has been dominated by a few institutions, and we take it as dogma, right? We take it as this is the only way you do things.
Yeah.
And then comes along a guy like Joel Mata and disrupts the situation. And I saw the whole process of people like bashing him in the podium, criticizing him. And it's very cool to see that happening because that it needed to happen, right? We were just comfortable. It's like I went to right before COVID, I went to a partial knee meeting in Belgium. And it's eye-opening when you go outside of your comfort zone and you see what people do,
Yeah.
the results they get. To me, it's fascinating. I'm like, I'm stuck doing gap balancing knees, posterior approach. What am I doing? And that has sparked in me to learn from people that think outside the box.
So from that small meeting at ACUS with 20 people, how did you decide? I mean, you were in practice at that point, right?
Yeah.
Yeah. So how did you decide? What was your journey there to go from this makes sense to this is now my practice?
I went to Smith and Nephew courses. That Kegi was the guy in my table.
Yeah.
I went to see Masones back. I went and saw him. I went to a lab that was Frederick Laud from France.
Yep.
And I was in his table. And then my partner and I at the Cleveland Clinic said, we're going to do the first like 40 together. Well, basically, I remember like today, the night before, we have 4 cases on the schedule. We're writing every step, like one by one, and we pasted it in the wall of the operating room. And, this retractor here, this retractor there. And we did like the first 40 together. We did it tableless. We didn't have a table. Then we bought the table. And then after that, it was cruise control.
So those first few didn't dissuade you from continuing, or?
To be honest with you, man, honestly, I always tell people like that would be in my situation.
Yeah.
That operating with a partner or something is really helpful.
Yeah.
Because it decreases the anxiety level, and then you don't have to be worrying about so many things at the same time because there's 2 competent surgeons there. And I think to me that was a blessing and something that I think helped me tremendously.
So the beginning part of that process, having a partner involved, that was a huge bonus for you. Since that time, what, in your opinion, or what in your experience has been sort of the single biggest game changer to how you do anterior approach?
So, I think that number one, it's interesting how the releases of the femur you don't understand them that well in the beginning.
Yeah.
Once you get through, I don't know how many cases you have to do, but once you get through, then you understand the releases, then it's like an aha moment. It's like, wow, now I feel more comfortable. I do the socket and probably the case is pretty much done with. The other thing that I realized also is like, I didn't understand how to interpret fluoroscopy. I thought I did. And then it wasn't until we started doing research and looking at our X-ray, we're like, oh, that's why that happens.
Yeah.
So I think that the new group of people and surgeons understand fluoroscopy a lot better than I did when I started DA.
Yeah.
So I think those are the two of the things that helped me and kind of propelled my comfort doing anterior hip replacement.
So I think you're right that people are coming out being better educated now about fluoroscopy, but I think that's because of work that you've done in this area. And I mean, your research has always focused on accuracy and precision in hip replacement surgery and in the placement of the components. And I'm curious, why do you find that topic to be so important?
Because that's one of the things that drew me to it. Like when I saw Joel talking about you can use fluoroscopy and then you don't have to guess. I'm like, well, I mean, because at Ortho Carolina, you would do the operation, they would get an X-ray and recovery room, and then I remember vividly they had a view box kind of next to the surgeon's lounge, and the radiologist they would put the X-ray there.
Yeah.
So it was there for everybody to see.
Yeah.
And you would pass by, and if it looked terrible, you just pulled it down and be like, okay, that didn't happen. So I'm like, why are we doing this? There's a way of doing this and not having to like have the anxiety of what I did.
Yeah.
Like now when I do a posterior approach for any reason, I have no idea where I'm putting my cup. I'm like, I have no idea where this is going. I mean, I think I am, but I don't.
How frequently are you doing posterior approaches these days?
I do maybe one every couple of months, and it's typically, I still have an issue with the anterior part when there's like fungal, like the skin doesn't look right.
Oh, sure.
I worry about that. I still, a bad Crow 4 dysplastic hip that needs a shortening osteotomy. I think I'll prefer to do that through the back.
Yeah.
Those are the kind of scenarios that I still probably go through the back.
And so tell me a little bit about your development of Cuptomize and your development of these technologies that sort of enable your precision in the operating room.
So one of the subjects that I've always been attracted to is the whole spinal pelvic thing and how that affects cup position, functional cup position. I did some early work with Corin, and I kind of was on the first ones to use OPS. Mm-hmm. And then when Andrew Cooper, a good friend of mine and co-resident, he developed VELYS or joint point back at that time. And I told him, listen, I think we should develop something to kind of with the spinal pelvic thing. And when COVID hit and we didn't have anything to do, we got together, him, the cook, and myself, and kind of figured this out. And that's what sparked it. We had time, and we put some seed money in it. We have Dr. Cooper has access to a very good coder, and then we worked through it with during COVID.
How many cases are you into using it at this point?
Oh man, I mean, I do every case with it, so probably more than 1,000.
Wow.
Because I use it on every case. I think I'm learning more and more about the subject. And, it's interesting because I think at the end of the day, I think that the best you can do, no matter what, is to put your cup at 40-25 in the standing position, right? There's not much more you can do.
The more you study, the more you come back to the first answer.
Because honestly, there's a limit to how you can manipulate the cup.
Yeah.
You can change the implant that you use, right? The information is valuable in the sense that you can say, well, this is a risky patient, and maybe there's really no safe zone, and maybe I should alter the bearing surface that I use, maybe a dual mobility or something like that.
Yeah.
But at the end of the day, there's so much you can do. And it's interesting because I don't know how you do the hip, but I was talking to a guy at AHF, and he was arguing that I should put my cup in the supine pelvic tilt. And I'm like, well, I've never had a patient dislocate supine, so I don't know why I would use that.
Right.
And so there's still I would think that most people say use the standing pelvic tilt.
So you adjust the position of your pelvis fluoroscopically to mimic the standing pelvis.
Yeah. With Cuptomize, you don't have to because you draw the SFP angle, it automatically knows.
Right.
But some people, they just look at the supine and they go from there. And I probably you do the same. But we just looked at over like 500 X's. We want to submit this to ACAS, and basically there's a lot of change from supine to stand. It's a lot.
Yeah, it's very patient specific.
It's very rare. So it's interesting how this still is a topic of debate.
So speaking of the AHF, now you this year were the recipient of the Joel Matta Award from the Anterior Hip Foundation. And I'm curious what your thoughts are on being sort of recognized by your peers as being a leader in not just anterior approach, but in excellence and in innovation in that area.
I never do what I do to get recognized, but it's actually pretty cool to get recognized by people like yourself, Joel Matta, Jonathan Gerasimidi, and because you guys are the thought leaders in this area, and to be recognized is it's humbling and it's pretty cool. I value the forum of AHF because I think again it disrupts a little. It's a disruptive forum.
Yeah,
and I think it's needed. It's something that I think serves a purpose, and I think it's something that people value, and I think it's something that helps our patients at the end of the day. So getting recognized in a forum like that I think it's pretty cool and a humbling experience.
Do you have the award with you? I'm curious. I've never actually seen what it looks like. You've got it.
I do have it.
Here, let's see. Oh, look at that.
Let me see. There you go.
Oh, very nice. Is it glass, huh? It looks like it's glass. Oh, that's
my daughters ask me, but Dad, what does that mean? And I'm like, I'm the best surgeon in the world. And they ask me, hey, Dad, does that come with money? And I'm like, no.
They said, no, you had to pay money to go there and pick it up.
Yeah. But I just think it's interesting in the perspective of, it's interesting now that I'm almost 50 and I look back a little bit, like, I think I've come a long way in my career. And if I look back, I would have never guessed that I would be in the place that I am. But it's interesting the perspective of your sons or daughters about it. Like, they come from a place of innocence, and it's just so nice.
Well, and they grow up with a different experience than you did, but yeah. So had you ever did you expect to be back in Puerto Rico, or was the plan always to come to sort of mainland U.S.?
Once you train in the U.S., going back there is hard because you don't have the same support. You don't have the same facilities.
Yeah.
So I always tell people, you have to accept some level of mediocrity to be able to not, completely burn out.
Yeah.
So, and I wouldn't be able to do all that I've done if I was there. I mean, there's excellent surgeons in Puerto Rico and they do great job. And, I know some of them that have done tremendous things, but I think that where I am, and in part because of the places that I worked and the support that I've gotten there, and the networking.
I had the opportunity to operate in Puerto Rico once with a former resident of mine who practices there, And what I found interesting was that the reps who provide the materials scrub into the case and act as surgical techs. And I was just blown away by this.
Yeah, and actually, some of the surgeons, if their rep doesn't show up, they'll cancel the case.
Oh my gosh. Is that the
Yeah.
same? And is it the same in general surgery too with your father?
No, general surgery, no, because the thing is that those reps are the ones that know the trays, the
Yeah.
instrumentation, so they rely heavily on that.
Yeah. It was such an interesting and unusual for me experience because, coming from, I don't know what it's like in your hospital, but I've been in hospitals where, heaven forbid, if the rep touches anything, it's an incident report.
They even dress them differently, so they have like this right?
Instantly recognizable.
No, but it's true.
So obviously you've got plenty of career left, but you have a lot of perspective now on where you came from and how you got to the place that you are. Looking back and at your experience, and if you were to give advice, whether it's to your daughter or whether it's to other med students or orthopedic residents or fellows, what could you share?
So, my daughter's a pre-med now, and one of the things that I tell her is like, listen, try to understand what you're going to get into ahead of time, right? Because in medicine they don't teach you what it's like to be a general surgeon. They don't teach you you get caught up in the hype of what you want to do, but the quality of life that you're going to have matters a lot.
Yeah.
For burnout, longevity. So I think it's important that the young people understand that before they get into it, because once you're in it, it's too late, right? I always use the example of the trauma surgeons in my hospital. They all want to be joint replacement surgeons at the end of the day because they're tired of taking call, having an unpredictable schedule.
Yeah.
So I think that's very important. And my dad always says that medicine is like a priesthood in the sense that you're like committed to your patients, and if you're not willing to do that and put that at the forefront of things, I don't think you'll be able to practice medicine the right way.
Yeah.
I think it's interesting, like I always have my phone, I'm available for my patients whether I'm on call or not, and it's interesting how now, like, the hospitalists or in the hospital or with other doctors, you call them on a weekend, I'm not on call, like don't bother me.
Yeah.
And I think, you got to be committed to your patients in order to provide good service.
No, it's very true. It's hard to go through all of that training and to go through all of the long days and the long nights and then decide you're not going to be available for the people that you put in all this effort for.
Yeah.
Well, that's great. Hey, are we going to see you at the next AHF?
Absolutely. I think Nashville was a great choice.
Yeah.
I liked it better than Vegas.
Yeah.
And it's a smaller town. Yeah, for sure. That's one of the meetings that I always do every year. And it was good to see this year. I saw a lot of younger guys that are really solid surgeons. That revision session at the end was
fantastic.
Phenomenal.
Yeah.
That was impressive stuff. And so, yeah, and I'm happy to collaborate and try to help grow it, and for sure.
That's awesome. Well, we look forward to seeing you. We're going to be in Nashville for 25 and 26. So that'll be good. And yeah, well, as always, love having you involved with the AHF and love the opportunity to talk with you. This has been great.
Thanks for having me, Joe. Appreciate it.
Thank you for joining me for another episode of the AHF podcast. If you want more information, you can check us out on Facebook, LinkedIn, or X, or you can visit us at our website, anteriorhipfoundation.com.